Hi. Today we're going to talk about pre-op and intra-op, and then there'll be another lecture about post-op. All right, so what are the goals of pre-op assessment? Well, a couple things, several things actually, not just a couple. We're looking at, one, how's the patient looking at this surgery? Do they have a plan in place? Is there, simple things like if they need someone to drive them home, or are they going to need rehab afterwards? Those kind of things. And the other thing is looking at, maybe past experiences too. Or maybe it's family members that have had past experiences with surgery. Definitely can play a lot into their anxiety as well. We also going to get a very good past history, medical, surgical, anytime they've had anesthesia. We're looking at if there's any risk factors that could potentially cause problems for this patient post-operatively. So it could be, a gamut of things we're asking questions about, and we'll go through a few of those just to kind of highlight some areas. The other thing is we want to establish a baseline. And what do I mean by that? Well, I mean labs. We're going to get, the usual CBC, type and cross match, most likely electrolytes. We want a baseline so that when we can compare it to the pre-op lab work to the post-op lab work to see if there's differences. The other thing is we're going to identify and document the surgical site or the procedure. This is going to help us, one, protect the patient and maintain the patient's safety. We're also going to talk about medications. Now, I don't want to just talk about prescription medications. Yeah, they're important. Granted, if your patient's on Coumadin, we need to know about that because they're going to have to stop taking it for about a week before surgery so that it's out of their system because of the increased risk of bleeding. The other thing is over-the-counter medications. We want to know about those too. What if I've got a patient taking aspirin daily? That also thins out the blood, right? So we need to know about that as well. We're going to ask about cultural and ethnic factors that may come into play here. For example, if you're a Jehovah's Witness, you don't want to receive blood products. And that needs to be addressed in the pre-op assessment. And then also, as the nurse, I'm going to ask them about what do they know what's going on? Do they understand what's happening? So why do we do it? Well, it is proven in the literature that it increases patient satisfaction, decreases fear and anxiety. And I can just stop right there because that is why I'm there as a nurse. But it also decreases complications, decreases length of stay, decreases recovery time. Granted, administration likes to decrease length of stay because the less time the patient is in the hospital and decrease complications, then it's a good case for them. I also want to focus on patient safety, and as always, I'm documenting everything that I teach my patient. Okay, so one of the things we do here is get an informed legal consent for a procedure. Now, it's important that we know that I think one of the huge keywords here is that it's informed. That means that the patient understands what's happening. One, the patient must be of sound mind. So, for example, my poor dad who has dementia, he cannot give an informed legal consent. I give it for him as his proxy. And we would need documentation of that. I would have to prove that legally that I'm his proxy. I would have to provide paperwork. So, okay, so we know it needs to be informed. They need to know what's going on. Who gives that information to the patient? It is the physician or the person doing the procedure. That is the person that is explaining the procedure to the patient. It is not I as the nurse, even though I may be able to tell them everything they want. Like, for example, I worked on a cardiac floor and we sent people off for heart caths, all the time. I could tell them all the ins and outs of the procedure and I could answer all their questions, but it was not my responsibility to give that information to the patient. It was that interventional cardiologist's responsibility to give it. What I could do as the RN at the bedside is I could witness the signature and clarify information, but I could not formally get the informed consent. Okay? So that's a big important part. Now remember, if English is a second language, you have to provide not a family member to interpret, but a interpreter that is designated by the hospital. Okay? And that's another important point. Okay, so pre-op checklist is pretty common. You'll use this the day of surgery, and it's going to go through literally everything you need to do. Make sure the dentures are out, contact lenses are out, nail polish is off, ID bands on, allergy bands on, labs are on the chart, consents on the chart. If there's some kind of skin prep that needs to happen, it's going to happen. If pre-medicate, if that's indicated. Patient is put in a hospital gown, and hopefully they're been maintaining NPO status. And then the key thing with this is when you review the lab work, one of the things is if you see any abnormal labs, you want to notify the physician right away. You're not going to send a message through the OR or anything like that. You're going to call them directly. The other thing is you're going to have recent vitals done on this patient as well. So during the pre-op experience, we talk about identifying risk factors. And now, there are definitely risk factors of surgery that patients are going to have questions about, and that could be, what's my infection, anemia, loss of volume, hypovolemia, electrolyte imbalances. I mean, all those can play into it, DVT. So we're going to do all teaching involving those pieces. So teaching them how to cough and deep breathe, teaching them how to use the in-center spirometry. The other thing is we're looking at possible risk factors that could cause surgical complications. So, I mean, that could be like if the patient has chronic respiratory disease, that could potentially cause complications postoperatively. If they're a smoker, yeah, I mean, that can as well. If they have heart failure, think about it. We give fluids during surgery. So if we're already have a decompensated heart and then we're giving additional fluids, we may have to alter their diuretics or watch them more closely, monitoring intake and output very carefully and auscultating those lungs. Diabetes, definitely that population is definitely at risk. They have obviously elevated blood sugars. So if stress, the surgery will increase the blood sugar even more. And they have increased a risk of delayed healing as well. Obesity patients are another example. They put more pressure on their incision. They are greater risk for dehiscence or evisceration. Older adults are a lot of reasons why they can be just because of age-related changes that can lead to potential problems for them. Other things we want to make sure that they understand is when they are on a list of scheduled medications, say their surgery is scheduled, for a week or so, that they understand which meds they can take the day of surgery and which meds they can't. That's important. Especially those blood thinners, we want to make sure that they understand what they can and what they can't take. Intra-op. What's the focus of intra-op? Well, this is when the patient goes to surgery, correct? They're in the OR. So basically what we're looking at here is safety. We're going to go through several safety checks to make sure that we've got the right patient, right procedure, that kind of thing. But definitely the focus on safety. Everybody has a role, and it's to protect the patient. You go into transferring them into positioning on the table, safety because there's hazards of anesthesia, the gases are flammable, protecting the patient from that, as well as just generally protecting the patient from general surgeries. So, okay, so I have a link here for a video. It's kind of a funny look at the timeout. This was created in the OR because there were several major errors that occurred that caused major issues for patients. I know of one where patient was due to have an amputation and they took the wrong leg off. That's a major problem. So this was created by the safety organizations to protect the patients. It's a funny look at what they do to protect the patient when the patient comes to the OR. So you definitely want take a look at it, see what you think. All right. So other things that occur in the surgical experience in the intra-op is the room prep. Um, Definitely the focus is on safety as well as in prevention of infection. When we transfer the patient to the OR suite, the identity of the patient is verified and safety measures are taken. That surgical timeout occurs before the induction of anesthesia. You always ask the patient to confirm their name, date of birth, operative procedure site, and consent. You also will compare the ID band, hospital ID band with the chart. During surgery, sterile field is maintained at all times. After surgery, they count sponges, instruments to make sure nothing's been left in the patient, as well as we're positioning to ensure correct alignment. Sometimes during surgery, patients get put in positions that are not quite comfortable looking. So we definitely want to make sure that patients are in a proper position post-operatively. And then just safety measures, safely administering medications, continually monitoring vital signs, any blood loss, as well as urine output. Safety is crucial in the OR. I can't say that's like the primary goal for those patients. What I also put here, this is a video about what is perioperative nursing. It's pretty informative for anybody that's never had a chance to go to the OR to see what the roles of the nurse are. It's done by AORN, which is their organization. And I would recommend you watch it, especially if you're considering this area. It's definitely an area of need. Um, I know friends that have worked there and love it. But I just thought that would be a good idea for you guys to watch. All right, so that is pre-op and peri-op or intra-op. Now, other things that your ATI has a great summary of patient-centered care, what labs are sometimes done, and breaks up the responsibilities really nicely. So I think you want to take a look at that for sure. Um, I think that will help you a lot. Now, the other thing, there's a chapter in your ATI about anesthesia. We're not going to really test you on effects or certain types of anesthesia, where there's general, local, and what does that mean. Mainly what we're going to cover when we do post-op is recovery of the patient from anesthesia. But just so you know that there are certain risks when they're under anesthesia, like intubation problems, but I mean nothing specific. I mean a lot of it has to do with airway. So make sure just you guys know about airway. I'm not going to worry about that for you guys. And then a lot of it is monitoring. Remember, like I said, continually monitoring heart rate, rhythm. Obviously, the O2 sats are continually monitored. Any intake, anything going in the patient or out of the patient, as well as monitoring the patient. So those kind of things we're looking for, but nothing specific about anesthetic agents.